Hello, I'm Sushmita Munshi. In my role at Manulife as VP and Head of Digital Products and Partnerships, my mandate is to leverage digital solutions to ensure the uninsured in our communities and support our customers to make healthier choices every day through our flagship behavioral insurance proposition, Manulife Move. We are a global insurer headquartered in Toronto with more than 100 years of presence across Asia, from China to Singapore, Japan to Indonesia. I'm absolutely delighted and privileged to be sharing screen space with a very passionate and distinguished group of thinkers. You are collectively changing how we think about our bodies, mind, and health. When I was asked to deliver the keynote, I have to say I was a little unnerved. While I don't have a doctor's degree, I work in a centennial insurance firm that has decidedly put innovation at the front and center. Manulife's bold ambition is to be the most digital, customer-centric global company in our industry. And we see startups as being a big part of our digital transformation journey. So in the next 15 minutes or so, I'll touch upon the work that I do at Manulife to transform digitally, and more specifically, what we have learned since the pandemic. I am then going to switch gears and talk about my 3 personal bets of healthcare innovation in Asia. So let's get started. A little bit about our learning in the last year. In early 2020, as the pandemic began to spread across Asia, we realized the far-reaching mental, social, and financial impact it would have on our customers and the communities we serve. We conducted 2 Manulife Asia Care Surveys, one in late 2020 and another in November. The survey looked at insurance customers' sentiment about the pandemic and provided a closer understanding of their concerns, priorities, and aspirations. There were 3 key findings. First, people want to get healthy. Health has always been important, but people often found it tough to make a concerted effort to develop healthier habits. Since the start of the pandemic, there was a marked shift in attitude and behavior among customers, prompting many to adopt new healthy habits. In May, around 50% of respondents said that getting more physically healthy was a new habit they have formed since the start of the pandemic. In November, we learned that nearly all of the respondents, 95%, across Asia who are concerned about COVID-19 had taken personal actions to improve their overall health, mainly through more regular exercise and improved diet, particularly in the emerging markets of Vietnam, Philippines, and Indonesia. Second, digital habits are accelerating. The survey also shows widespread appetite for digital health and wellness propositions, with underinsured markets in particular showing greater interest in insurance protection. 61% of insurance customers reported using online payments since the outbreak. Third, there's a greater appetite for insurance protection. COVID-19 is making people appreciate the value of insurance more and making them more aware of the importance of saving for retirement for their children and families. Interest in buying new insurance across Asia has risen from 62% to 71% since the last survey we did in November. Life insurance products offering protection from critical illness, health concerns, and hospitalization were of particular interest. Our assessment is that amid uncertainty, people are finding ways to take control of their health, financial planning agendas, including through the adoption of digital. In many ways, the pandemic has fast-tracked digitization, and those digital habits are here to stay. So what did we do about it? Manulife has responded to these changes in our customers preferences with tools and solutions to make lives better. Our health solutions are focused on prevention. Societies in both emerging and developed markets are faced with rising health medical costs. As an insurer, we have an important role to play in educating customers about healthy living, prevention, as well as about the right levels of protection. In particular, we are focusing on behavioral insurance by nudging people to make healthier lifestyle choices and adopt healthier habits like exercise, nutrition, and health monitoring. Behavioral insurance is a strategic priority globally. The proposition varies by market, but with a common focus on health issue prevention. Combining insurance with a technology-enabled program educates, supports, incentivizes, and rewards customers to live healthier lives. We offer behavioral insurance in partnership with Vitality in the US as John Hancock Vitality and in Canada as Manulife Vitality. In Asia, we offer a homegrown flagship program, Manulife Move. Manulife Move is a behavioral-linked program that integrates activity tracking with insurance solutions to motivate healthy habits among our customers. This flagship program, delivered through the proprietary Move app, focuses on wellness. Manulife Move is now available in 6 markets: Cambodia, China, Hong Kong, Philippines, Singapore, and Vietnam, with more than 1 million customers on the platform. In the last couple of years, we have strengthened our health solution proposition by building out a holistic health ecosystem through partnerships with leading health tech companies like Dakadu and Howdyf in China, very similar to the companies we have here today. Dakadu is a Swiss-based digital health platform provider. We're using their patented health score to help our customers how healthy they are on a scale of 1,000. Customers are given their initial Move score after answering 6 questions. With this new, easy-to-understand metric, Manulife Move helps customers take control of their health. The Move health score changes every day in real time, influenced by the customer's activity, steps, body profile updates, nutrition, and lifestyle choices. When tracked consistently, the score offers a reliable indicator on how a customer's health is evolving. This personalized journey is based on over 2,500 clinical papers and extensive scientific research. In 2019, we partnered with Howdyf, or Good Doctor in China. As China's population ages and chronic disease gradually consumes greater resources in terms of epidemic prevention and health management, the supply of healthcare services is currently insufficient to meet growing demand. We are fully committed to building out a comprehensive ecosystem to ensure that our Chinese customers can live the healthiest lives possible. This internet plus insurance plus medical model provides solutions to the problem by leveraging digital technologies, product innovation, and the consolidation of healthcare resources. Our focus on prevention is based on a win-win-win philosophy. It's a win for our customers who have healthier, better lives. It's a win for society because you have wide adoption of BI. Governments would spend less on healthcare. It's a win for insurers as a focus on prevention helps us become more efficient and customer-centric. So essentially, it's a shared value approach. It's a whole new approach to life insurance. Now switching gears, I'm going to talk about what gets me excited and what my personal bets for healthcare innovation, or things that I'm excited about, and I have 3 of those. Our grandparents' generation focused on rebuilding societies after the ravage of Second World War and closer home as many Asian societies were decolonized. Our parents focused on building wealth or providing a financially secure life for themselves and for us than the one they had inherited. I often wonder what our legacy will be. The future will look back at us as a generation that made investing in your health a priority. And this is my first bet. It's not a chore anymore. It's made it cool and hip. Insurers like us at Manulife play a much bigger role in improving customers' health in their lives than before, going beyond just paying claims. A vast group of technologists are focused on changing what we put in our bodies, how much we walk, and the hours we sleep. Private and public partnerships are driving towards making people make healthier choices. From Michelle Obama's Let's Move initiative, Nike Run Club, to the Singapore government's pledge of a diabetes-free Singapore. These initiatives come from a good intention of ensuring that if we as a generation are going to live till 100, we better do so being mobile, mentally agile, independent, and hopefully financially solvent. My second bet is that there will be a demand for solutions focused on the niche opportunity of women's health, specifically older women. Women's health is one of the lesser researched areas in medicine, specifically menopause. In the last 3 decades, women's health has been focused on fertility to enable women to wait till their 30s and 40s to procreate. On the other side of the childbearing years, millions of women every day struggle with the symptoms of menopause, with limited guidance on how to manage their everyday lives. Often resorting to homemade recipes and tactics to manage the hot flushes, disrupted sleep cycles, osteoporosis, and anxiety. As the IVF generation takes their place in the boardroom, it is likely treatments and assistance around menopause is at the cusp of becoming mainstream. My second bet is to make menopause mainstream. Finally, and my third bet is that we all know mortality and our likelihood of getting good treatment is directly linked to where you live and how much money we make. The distance between your doorstep and the closest clinic often dictates, in some extreme unfortunate cases, whether you live or die. Digitally delivered healthcare coupled with IoTs is already commonplace in many markets. Beyond the hype of VC funding millions of registered users, their real achievement is that they have democratized healthcare and will truly be the makers of healthcare without frontiers. Thank you.